Hi, I'm Dr. Kevin McVeary. I'm a clinical urologist. I practice at Loyola University Medical School in Chicago, Illinois. I'm a professor of urology at the Stritch School of Medicine at Loyola University of Chicago.
Hi, and I'm David Staskin, and I'm an associate professor of urology at Tufts University School of Medicine, and I practice at St. Elizabeth's Medical Center in Boston, Massachusetts.
So the objectives of this national broadcast are several. One, understand the impact of overactive bladder or OAB in men with benign prostatic hyperplasia, BPH. We're also going to review the efficacy and safety data from the Phase 3 COURAGE trial, and we're going to hear from Bruce, a real patient with OAB and BPH, about his experience with Gemtesa and how it's helped improve his OAB symptoms. At the end of the broadcast, we'll hold a question and answer session.
We're excited to talk to you all today about an indication for Gemtesa, Vibegron, why it is important, and the pivotal trial that led to this indication.
As you may know, Gemtesa is a beta-3 adrenergic agonist approved for the treatment of overactive bladder in adults with symptoms of urinary frequency, urgency, and urge urinary incontinence, or UUI. And today we're going to talk about indication for Gemtesa in adult male patients with OAB symptoms and who are currently on treatment for BPH.
Yes, as you mentioned, Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. In addition, overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacologic therapy for benign prostatic hyperplasia. Gemtesa is contraindicated in patients with a known hypersensitivity to Vibegron or any of the components of Gemtesa. Hypersensitivity reactions such as angioedema have occurred.
So before we get into the data, we're going to start by discussing OAB in men, how it's related to but also differs from BPH, and its impact on patients' lives. So Dr. Staskin, what's the difference between lower urinary tract symptoms, or LUTS, and OAB?
LUTS is an umbrella term for the complex of storage, voiding, and post-voiding symptoms. In contrast, OAB is a subset of LUTS and considered a storage symptom complex. LUTS in men have historically been attributed to BPH, but it is now recognized that the underlying mechanism of LUTS are often complex and multifactorial. OAB is a syndrome defined by the presence of urinary urgency, usually accompanied by increased daytime frequency and/or nocturia. We tend to think of OAB as predominantly affecting women, but Dr. McVeary, how prevalent is OAB in men, and how often do you see it in your practice?
So OAB in men is more common than we all think. In the US, the prevalence of OAB in men is about 15%. The prevalence of OAB is similar among men and women, and it's really not generally appreciated. Despite this, participants in clinical studies of OAB are disproportionately female, which then may limit the generalizability of the findings.
Well, how can we differentiate OAB from BPH? What are the symptoms of BPH?
Well, historically, both irritative and obstructive symptoms are observed in men and are attributed to BPH. However, it's now recognized that the irritative symptoms are due to OAB. The diagnosis of LUTS etiology in men is complicated by the frequent concurrence of storage and voiding problems, which makes it difficult to discern BPH from OAB. While BPH is predominantly associated with voiding problems, including urinary hesitancy and a poor and/or intermittent stream, storage problems that are the hallmark of OAB, including frequent urination, urgency, nocturia, and the sensation of incomplete bladder emptying, may also occur. Therefore, it's likely that some cases of LUTS are due to OAB, and they may be incorrectly attributed to BPH, and vice versa.
Would you agree that because symptoms are so similar, it may be hard to differentiate the two, making the diagnosis more challenging?
Yeah, I would. Physicians tend to focus on BPH, and therefore OAB is often underdiagnosed and undertreated. Men with LUTS, 62% receive a BPH diagnosis, and 74% receive a pharmacologic BPH treatment, whereas only 26% receive an OAB diagnosis and 7% receive OAB medication. So let's talk about the consequences of underdiagnosed OAB. How does it affect patients, Dr. Staskin?
Well, in my practice, I've seen that OAB can have a negative impact on men. Therefore, it's important that their OAB symptoms are treated.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.